First, I will start by acknowledging the traditional custodians of the lands on which we're meeting today, and for us here in Bendigo, it's the Dja Dja Wurrung country, and pay our respects to the Jara people for looking after the land all these centuries, and pay our respects to elders past, present and emerging. So, research. To me, it's a lot like cooking. It really is. You look in the fridge cupboard, you've usually got some of the ingredients. You work on the wards, you work wherever you're working, you've got lots of different ideas. So you've got some of the ingredients there, but then you might have to add some. Like when you're cooking, you think, okay, I've got these basic ones, but I need some more herbs, I need some more stock or some olive oil or something to sort of get it all happening with. Very similar to the ideas that are going around in your head. So, you know, when you're thinking about an idea or some research, when you think, you can relate it exactly back to how to cook. You know, I'm hungry, what am I going to make? Do I have time to make something really complex like a, you know, a la carte meal, or should I just make a sandwich, or, you know, fresh processed, all of these things that you think about, the ingredients, how do you prepare them, the different ways of cooking the ingredients, all of those things, how do you want it to taste, etc. And even to the end result, how do I serve it? And would my family or friends be interested in eating this too? So when you relate it back to that, it really is, research is about getting the basic ingredients right. So you've got an idea what you're interested in, but what in particular do you want to explore about that idea? So you end up sort of thinking about it a bit more and developing and defining a topic, looking at, okay, what do we already know about this area? So understanding the current evidence that's out there. What do you want to know? You know, what's the gap in the research? What do you actually want to know that's not already known? So formulating your research question or hypothesis. Why is it an important thing to research? Might sound good at the time, but is anyone else actually going to be interested in the outcomes? And can you answer the question? So what information you're going to need to be able to actually develop it up and answer the questions. So it really is like a recipe book. You know, you've got your ingredients. When you look at a recipe, you've got your ingredients, then you've got what you need to cook it with, and then you've got your actual instructions for cooking. Same thing. So what kind of information are you going to need to answer the question that you actually want to answer? Where will you get the information? How will you get it? Do you need permission to get the information? What will you do with it once you have it? How are you going to keep it safe and secure? How much time do you need to complete each component? And how much time do you actually have to complete your study? So again, very similar to cooking. But it's really interesting because it all boils down to the idea. So you've got an idea, what do you do with it? Because, you know, you're working away and you think, oh, geez, I reckon we could do that a bit better. We could do that differently, or, you know, something comes up and you discuss it and you think, no, I reckon I could really focus on that. We could work out a QI, then maybe an improvement science, go on to research, and it can go through the continuum. So, you know, when you've got a good idea, and are you, any of you here because you've got this idea that you think, I might want to actually research, or no? Have you, in the past, have you thought, how have you started? Have you actually come up with an idea, or someone's come to you with it and gone, okay, I think this would be a good idea? It's different when you work on the units, I guess, or wherever you're working. The ideas can come from a lot of different angles, I suppose. You know, particularly audits around, well, the recent accreditation, for example. I'm sure there's lots of ideas that have come out of the results of the audits that were being done around that. But the basic thing is discuss with colleagues and manager, scan the literature to see what's already been done in the area, because you don't want to reinvent the wheel. Always discuss with R&I or quality units. So the research and innovation team are a friendly team. Yes, we're over in the White Tower, but we're very approachable, and it's only just across the road, across the garden, across the concert hall, across the hall. Pop up and say, hey, I want to do this. What do you reckon? And quality is just downstairs from us, so so that helps too, and that sort of just helps. When you have any sort of idea, it's always good to sort of brainstorm it with someone and just throw it around, toss it around and see if it's actually worth developing any further. And then when you have decided, okay, I've got the right idea, this is what I want to do, then decide if it's QI or research, because as you know, it's quite a continuum really from quality improvement. You can do your basic, plan on a page, business as usual, quality improvement projects, but they can actually morph into something more substantial, into quite a complex, translational project, or then into research. How do I know if it's QI or research? You probably can't read that all that well, but there's a checklist that guides you. So the NHMRC, the National Health and Medical Research Council, they're sort of the overarching gold standard for everything around research in Australia. And they actually have heaps of guidelines and documents and helpful fact sheets and all. But one of them is around, is it QI or is it research? And we've actually redeveloped the QI process here, and that the new process, including this checklist, will be launched shortly. I'm hoping next month, because it depends on how you answer these questions, whether you go the QI path or the research path. So, the activity poses risks beyond routine care, including any sort of distress or harm. If the activity has the potential to cause more than just mild inconvenience. If it infringes or potentially infringes privacy or professional reputation of participants, providers or organisations. If the activity is to be conducted by a person who doesn't normally have access to patient records for clinical care or a directly related secondary purpose. Data or analysis from the activity will be used for a secondary purpose. So if you answer yes to any of these, it's a trigger for ethical review. That means it's very likely to be research. Same with information gathered about the participant will be beyond that, what's routinely collected. So we collect heaps of data every day, as you all know, and we have it all there. If it's, if it's additional to what is already collected, then we have to think about it a bit more. If there's testing of non-standard or innovative protocols or equipment, so not standard care, there'll be comparison of cohorts, randomisation or use of control groups or placebos. If the activity risks the privacy or confidentiality of the individual beyond that experienced in routine provision of care. And if there'll be targeted analysis of data involving minority or vulnerable groups whose data is to be separated out of the data collected or analysed as part of the main QI activity. So, for example, if you're going to, look at a cohort of patients with a particular illness, but then you're going to have subsets of those who weren't born in Australia, those who are Aboriginal or Torres Strait Islander descent, they're likely to be small groups, so they're vulnerable and minority groups, and that, it always makes it potentially re-identifiable a lot of the time when the smaller groups. So you've got to really look at whether you're going to separate out, have you got enough data that you can separate out into small groups or not. The consent acquired for routine care from participants is inadequate to cover the proposed activity, or the activity is inconsistent with the Australian privacy principles. And they're just spelled out there. And the last one on the bottom there is, if you're intending to publish the findings in a journal that requires evidence of ethics approval. So there's always been a little bit of a thing about oh, I have to get ethics approval because I want to publish the results of this project, whether it's QI research, whatever. It's not really, you don't need ethics approval per se to publish. It depends on the journal that you're publishing in, because most journals will ask for your ethics approval number. So we now have a process at Bendigo Health that you can get. So research goes through the research process, QI goes through a QI process, and you get an approval of QI letter with the number and everything that you can submit to a journal. So that's hot off the press, coming hopefully next month. So you've worked out it's research. First thing to do, define the research question. And I am going to really bang on about this because it's the most important part of research. It's really important to define it quite clearly at the outset, and then you can, then everything else sort of flows from that. So define the question, consider the feasibility of the project, and in doing all of that, that helps you then go, okay, yes, I can answer this question. I do have the information to be able to feasibly conduct this project. So now I'll develop the research protocol. Once the research protocol's developed, you submit for review. We're going to implement a peer review process for protocols that go to the ethics committee for review. The protocol is now on prompt to the pre-submission peer review protocol, I think it's called, but we haven't implemented it yet. We're waiting until the protocol got up there, but we'll put out some comms about that shortly. Respond to requests for changes once it's been submitted to the ethics committee, and hopefully then you get the ethics committee approval, implement the study plan, report results, and submit for publication. So we're just going to focus on the first part of this, defining the research question and pretty much developing the research protocol, what you need to do that. So why am I going to bang on about the structured research question? And it's because it really does help point you in a specific direction. It narrows down your scope, and it focuses you on the topic, and you're actually able to ask a manageable question. It helps identify your key or main concepts, and that in turn helps build your literature search or strategy. And that, of course, improves the information retrieval, and you're then able to evaluate the appropriateness of the information retrieved. So question your question. Explore the questions. Ask open-ended how and why about your general topic. Consider the so what of your topic. So why does the topic matter to you, and why should it matter to others? And that's really important, because sometimes we're so incredibly passionate about a topic and we really want to research it, but we don't clearly define the question and what it would mean to others to answer that question. They may not be as passionate. Then we get really frustrated because they're not as passionate about us, which is very, very frustrating. But you've got to think, yeah, will the majority want to know the answer to this question as well? So determine and evaluate your question. What aspect of the more general topic you'll explore? Is your question clear and focused? So it's got to be fairly specific, and it's got to be fairly complex. So of course you don't want something that you can just answer in a simple yes or no. Why did the chicken cross the road? We come back to that age-old question. Any answers?
Get to the other side.
I'm
not sure you're going to have some dad
someone
jokes
had
there.
to, someone every time.
There are some dad jokes amongst us, though.
So why did the chicken cross the road? Is it a good question?
No.
No. Why?
Because there's not enough parameters in the question. So it's one chicken. That's not enough to generalise to just because that chicken chooses to cross the road to get to the other side doesn't mean 50 million other chickens are going to do the same thing. Doesn't say what road. That we need to work out, is it a freeway, because that's different from a little cobble back road. And then we don't know what's on either side to be either making it cross the road to get away from danger or go to the other side because that's where its partner is. So it's very broad too, isn't it? Why? Yeah.
The
exactly.
why, yes. And you're exactly right. Why did it cross the road? It doesn't address which chicken, what road, too broad, doesn't define the segments of the actual analysis that you're going to do. So what about how many chickens crossed Barnard Street, Bendigo, Victoria on January the 1st, 2024? Better, but really we could answer that in one sentence. There's no real room. It was, so how many chickens crossed? 10. Oh, okay. What are some of the environmental factors that occurred in Bendigo, Victoria between January the 1st, 2020 and February 2024 that would cause chickens to cross Barnard Street? So this question can actually lead to the author taking a stand on which factors are significant, allows the writer to argue to what degree the results are beneficial or detrimental. So can you see the real, they've really honed in on, okay, it's not just why did the chickens cross the road, but what made them why was the environmental factors. Where it was Bendigo, Victoria, dates, what time frame are you going to gather the data from, and what would cause them to cross that actual Barnard Street itself.
And you also get more buy-in by being more specific, because if it's why are the chickens, people are like, oh, well, that's, they can't picture it, so they're not really going to care about it. But where they go, yeah, actually, January 2020 and 2021 was floods. Actually, it would be really interesting to know that. So that you giving people information, the more likely they are to be interested in helping you answer it.
Yep. So it makes it a bit more complex, but it makes it a lot more doable, I suppose. So what makes a good question? And again, using SMART, everyone uses SMART objectives. Health is really good at that. We're always looking at them to be smart. So it's not a fishing expedition. It's got to be measurable. So it's got to be statistically testable. We will, I'm very happy to share these slides, and we will put these presentations onto our website as well for people too. It's got to be attainable, so something you can do, and realistic, so something you can do within your resources and time. That's one thing we never seem to have enough of, isn't it? It's got to be timely, so it's got to be relevant to the here and now. So that's why, a couple of years ago, research into COVID just took off. Why? Because it was timely. And it still is. There's a lot of long COVID and all going on now, of course. And it's got to be important to you and others and meaningful. So whether the answer is yes or no, it's got to be meaningful. And I was thinking, the answer's no. So then I thought of the ASAP trial, and I thought the Australian, if Amanda was here, she'd tell me straight away, but it was testing vancomycin in as well as a normal routine antibiotic for joint replacements, and they had added vancomycin to see if it made a difference and less infection and all the rest of it. They found that it didn't. So that wasn't a waste of research and resources. That was an important question that the answer was no, it actually didn't make a difference, but it saved anyone else having to do that research. It found out a question, it actually had a really meaningful answer. And that study actually won Clinical Trial of the Year for Australian Clinical Trial what's ACTA? Australian
Clinical
Clinical Trial Alliance. So yeah, won Clinical Trial of the Year award, even though their findings were didn't make any difference. So I found that quite interesting. And that's why you have to narrow it down. As soon as you get a question, you just keep asking questions about that question. So who? Are you interested in a specific group of people? So can your topic be narrowed down by gender, by age, by ethnicity, socio-economic status, or something else? The who and the what. What are the issues surrounding your topic? Are there subtopics? If you're looking at background information, did you notice any gaps or questions that seemed like, why didn't they look at that when they did that study? You know, what are the gaps in the literature? Where can your topic be narrowed down to a geographic location? And the warning, of course, there, especially in rural regional health research, is don't get too narrow, because you might not be able to find enough information in a town or state. And it's quite interesting, because there's a bit of an argument about whether you should use postcodes or just local government area, and you know, it depends on your question, on your research, and on that patient population. So who, what, where, and then when. Is your topic current or historical? Is it confined to a specific time period? Was there an actual event that led to your topic becoming an area of study? And why are you interested in the topic, and why should others be interested? And it's really interesting to, you know, to find out some answers to things, but if they're not going to make a big difference to, you know, well, for us as a health service, you know, to people's health, well-being and comfort, then, you know, why would people be interested? And the how, of course. So what kinds of information do you need? What are your primary sources? What are your stats? What's your methodology? And when you're thinking about your literature and your research questions, you know, there's lots of different frameworks you can apply. And it's a really good idea, because it helps to identify the key concepts and just really helps determine the inclusion and exclusion criteria as well for research. And PICO is probably the most popular, and PICO-S, of course, with your study design as well. I won't go into all of those because when you're looking at translating your question into a search strategy, the librarians do a lot better than I do. So they're your original search engine. The Angels put this together for me a while ago when we were doing a combined presentation, and they used the PICO to list the concepts and terms for, do adults who binge drink compared to those who do not binge drink have higher mortality rates? And narrowed the search, showed people how to do a search on that very fascinating topic. So, but I'm not going to go into it, because next month in the research seminar series is how to do a literature search, and the Angels will take you through the search strategy, reference management software, and using Covidence. If anyone hasn't heard of Covidence, fantastic systematic review software. Saves you so much time with your literature review, and if you're doing a systematic review, absolutely fabulous piece of software. So I'm just going to focus a little bit on developing your protocol. Any questions today? Feel free to butt in. I do tend to talk quick. So sometimes I'll call a question a hypothesis, but really it's just, what are you going to investigate and why is it important? So what's the significance of the study? So a protocol will step through the question, the importance of the study, significance or rationale or background to the study, like what brought you to this, and why is this particular study going to make a difference? When and where will the study take place? What's the methodology? And that's, of course, your procedures and methods to be used. Your research design, how are you actually going to do it? Proposed timetable and budget. whatever you think your timetable and budget is going to be, I suggest doubling it at least, because everything takes more time and costs more money than you always think it's going to. And of course, the other resources required, so your technical, scientific, financial, IT resources, performance reporting unit, all of the different ones you might need. So the protocol, so the first thing you do, so you've got your idea, you've done a lit search, you've decided what you're going to focus on, and the protocol step you through, okay, not just the research parts, but sort of the admin details as well. Like, who are your researchers? So who's your principal investigator? Who's your associate investigator? Who are the other people that are going to be helping? Your project summary, so they always want just a really short layman's summary at the start. Then an introduction to the research topic and background, and that's quite often your literature review. And in the protocol, quite often you'll summarise your literature review almost like you would an exec summary when you do a lit review, and you'd have an executive summary that just summarises the main things, and then quite often you'll attach your lit review to your protocol when you submit it to ethics. So any preliminary studies that have gone on, either that you've undertaken or others have undertaken prior to this study, and that this study might build on. It's quite often that does happen. What are the objectives of the study and or study questions, and the statement of the protocol problem? And then they get into methodology, and in the protocol it's quite detailed methodology section. So they want to know the study design. Is it qualitative? Is it quantitative? Your study population, who are you going to actually study? The methods of recruitment, are you going to put out ads in the paper? Are you going to email targeted groups? Are you going to do a mail out to a certain cohort of people with diabetes or some sort of illness that way? Your variables list, your sample size, and that's really important, your sample size, if you're going to do complex stats analysis, and to be statistically significant, something to be statistically significant, you need a power analysis and all the rest of it, and you've got to do all the calculations to make sure that what you actually come up with in the complex analysis is not just statistically significant, but is legitimately and validly significant. Because if you haven't got enough sample, it won't be. So there are calculators, just online Google calculators that you can put in, like your total population of 1,000, and how many, you're going to. Your total population is 1,000. You're going to include 600. What does that mean? Your confidence interval would be that it's generalisable to others if they took the same sample size. So lots of different ways to work that out. My advice is talk to someone, because stats is an area of expertise all in itself.
Is there someone in the hospital, and you can talk with about that?
Yeah, look, Kevin Masman is usually the go-to. If he's not available or around, or it's a bit more complex, then he can manage. Then George from La Trobe, do you know George Natsaganian? He's offered to help us pretty much provide advice for people. Like, he's just a great guy who loves stats and can't believe that Bendigo Health and all health services have so much data and no one's doing enough with it. So he's just a passionate person, and he's really great at actually honing in on, okay, what do you need? What data have you got? Okay, you need to do this sort of analysis, and that makes it legit. And because, you know, even in your study design, your quantitative, quantitative, different things, but, you know, then is it cohort, is it longitudinal, is it survey design, is it, you know, what are the actual methods of data collection as well as,
And I just add that there's situations where you're not going to be able to get a sample size that's going to be able to give you a confidence interval that is, you know, generalizable or this or that. That doesn't mean that you shouldn't do it. It just means you have to talk to it to say, well, this is still important for us to do. And yes, it's not potentially generalizable to the whole population, but this will be great for Bendigo Health because of A, B, you know, C and D. So it's not a hard stop. It might mean, hey, to revisit the way that you're doing the study, and that, okay, maybe a cohort isn't the way to go. Maybe we change it and have a look at it a different way, or, you know, can we get the answer? Can we get half the answers by just doing an audit? And then that will give us further insight into maybe changing our methodology so that, you know, we could do in-depth interviews and get the answer a qualitative way rather than going down the quantitative route. So it's, you know, there's lots of different ways to look at a problem. And yeah, having sample size isn't a hard stop.
and sometimes the methods can build on each other too. You know, you could have your quantitative data and, you know, have even, I'm thinking back my, gosh, having nightmares now, my thesis, my PhD thesis. Now, I fully intended to do I'm a very quantitative person. I thought, yep, no worries, it was part of a larger NHMRC funded study that was going on in 3 different states, and I was doing a Victorian component, regional, because everyone else was metro. So my sub-study, I went and assessed 437, I think it was, people with dementia, and worked with their GPs on the management. And I thought 437, you know, I've got so much data because I had all these, you know, different cognitive assessment tools and all, and I had the GPs. And I worked with each of the GPs. It was in Bendigo, Castlemaine, Woodend, Bort, Elmet, lots of different towns, real regional perspective on how GPs were managing, and I was doing my assessment, they were doing their assessment, and all the rest of it. In the end, didn't have enough data. It wasn't going to be, my results were not going to be statistically significant, just because of the way we had done the actual data collection, and hadn't worked out the power analysis first for what I needed. If I'd had maybe 500, I would have just scraped through, but 437 didn't cut it. And we originally thought we only needed 400, which was why I stopped at 437. So 6 years later, we had to rethink that and go, okay, so out of that, what can we do? And so we ended up putting in a qualitative component as well, and I did interviews with the GPs and the practice nurses and all the rest of them around their management of dementia, and also their training and education, and lots of different qualitative data points that we could plug in.
Wouldn't a number like that be significant in a regional area though?
That was my argument.
Yeah, like it might not be in a metro
compared to the metro, no. Yeah, and because there was this many in the total population, I only had this many, and the metros had this many, we couldn't compare anything. So that was the main thing. I wasn't able to compare the metro versus regional differences, which is what I really wanted to focus on. Which was very disappointing. But we also did some quantitative assessments of GPs' attitudes and confidence towards dementia, and the metros did it as well as my regional GPs, and that turned out with some very interesting findings anyway. But, and I met 437 beautiful people that, you know.
I remember meeting you.
I wouldn't remember meeting
Very
me, but
seriously.
I had that many cups of tea and glasses of lemonade over those years. But it just shows that you sometimes, you know, you think you're on the right track and you think you've got all your ducks lined up in your methods and your study population and all the rest of it. My supervisors were all on board, you know, it was all go. And sometimes you just got to pivot and go, okay, how can we make this, more valid and generalisable for the results?
I love stats, don't get me wrong, but sometimes the statistical significance isn't actually a clinical significance as well, and that's the other trap that statisticians like to fall in. Oh, but it's statistically significant, but it makes no difference clinically.
Yeah.
So there's lots of traps to fall into, and so if you're thinking about stats, you'll have your stats nerds like me. It doesn't necessarily have to be like that. It can be made easy for you, so don't freak out about it. We can help you.
And the other criteria have clinical significance, but not be statistical.
Yeah.
significant.
Yeah,
So,
that's the other
Yeah.
thing.
Because how would you even get numbers to compare with Metro from regional?
Oh, look, there's many varied and different ways.
Right.
But that's probably another hour session.
Okay, sorry.
But no. Yeah, I always say, you know, quantitative's great and it does, you know, it's meant to be the way to do research, but quantitative will give you the answer. Qualitative will tell you why you got the answer. You know, it sort of gives the context to the numbers. And, you can get some really interesting findings. And timelines. You're always going to blow out your timelines, so make sure you think of that at the start and allow leeway. Make them very conservative, very not conservative timelines. Strengths and limitations of the study, and of course issues for ethical review and approvals. And we do have a template protocol, so when you're starting to write up your research, look on the research sites and you'll find the protocol. I think I don't know whether it's on Prompt or just on the research websites, but there's protocol for research at Bendigo Health, and it walks you through all of the those components that we just looked at, and it really does help you with the steps to research. So your question's clearly defined, your background literature's been summarised, the importance of the question is absolutely clear. You know that you've got the research team with the skills to be able to conduct the research, all the necessary resources are identified. And a lot of the times that's your supporting departments as well. You know, your med imaging, your pathology, your pharmacy, all the rest of it. Study aim and objectives clearly defined. And so what do you need to do to achieve the aim and objectives? And that's, so you've got the aim and objectives, but then you've really got to focus in on your methodology and how you're going to do things. And look, again, not going to go right into it now because, oh my goodness, in August, there's another research seminar series session and it's all about research methods and what method best suits your research. So, because it's a whole other Pandora's box when you get into, okay, what methods? But you've got to look really at your study design, you know, is it cross-sectional, is it a longitudinal cohort study, is it, you know, just a snapshot in time? How you're going to design it up, your population methods of recruitment, your variables list and data fields, and that can take a few spreadsheets just in itself. Yeah. Spreadsheets are fun, particularly Excel. I love Excel.
I feel like I fall on the quality.
Interestingly, there's even what I call quantitative methods in qualitative, because now you enter all your data into NVivo or one of the databases that you know, look at qualitative research, and to me that's it's almost taken the fun out of the qualitative because it still goes into a machine that spits things out for you. But I like theming, you know, I like the spreadsheets and coding matrix and theming it myself. But yeah, so looking at that, your sample size, your methods of data collection, and collection tools, because sometimes, and one of the words of warning, when you're looking at survey designs and all the rest of it, one of the methods, of course, don't use SurveyMonkey. You can use it for staff and you can use it for, non-private things, but we never ever use it with patients because it actually goes to America, and they clearly state on the SurveyMonkey copyright thing that they can use your data in whatever way they want. So we are getting REDCap. Well, we've sort of got REDCap, haven't we, Kathy?
How's it going?
Well, it's getting there, I believe. Kevin's having little breakdowns about it because they upgrade and then it didn't transfer some data, and
Oh, okay.
there's been a few issues, but we will we'll be getting that out and about a bit more. So look at data collection tools, plan of data analysis, and your work plan. Some of the common issues, particularly in participant recruitment and consent, that the ethics committee or the research governance office will pick up on, it's often very broad and not well defined. It's, I'm going to recruit 100 participants. That's not helpful. Like, who are they? Are they over the age of 18? Do they have a specific disease? Are they a specific discipline? I'm going to recruit 100 nurses over the age of 18 in a regional health service. Really define who you're going to recruit. How many will you recruit? So how many do you need? And what's your inclusion and exclusion criteria? How? So, it's email invitation, face-to-face, advertisements. It's, really important when you're developing a protocol to really think about these. How are you actually going to get to the people you want to get to, and how you're going to gain informed consent. There is a checklist in the Victorian specific module, which is brought out by the department, that you can look at, and it has a sort of checklist on what information is being collected and for the purposes and by who and what rules apply to it and all the rest of it. So there are lots of different checklists, and if you're ever in doubt, just give us a buzz or come up and see us and wander over, and we can show you where to go to get the most relevant one to your needs. And then there's lots of common issues in the statistical analysis section too, and I won't even try to pretend I understand all of this, because if I don't understand something, I will ask others. Hence Kevin and George and lots of other people that can help us out as well. And that's why in September and October, the research seminar series has a couple of part 1 and part 2s on stats. So statistical methods analysis and reporting. And because as you can see, it's quite a complex thing when you're looking at significance threshold levels to be adopted, and your sampling frame, your study IDs, data linkage keys, all these different things. The other common issues are usually around the data and privacy, because I think we're a bit better in health services because we do, have the Health Records Act and the health privacy principles, but quite often when you're doing collaborative research with universities, they may not be as aware of some of the actual health privacy principles. So yeah, just to be aware of some of those, and you're not expected to know them off by heart. After a few goes, you probably do start to learn the important ones off by heart, but there's lots and lots of resources again that can help with that. And the hot tips: use the researcher's Bible. So, for us, the National Statement on Ethical Conduct in Human Research 2023 from the NHMRC really is your go-to. And so is the Australian Code for Responsible Conduct of Research. They're both really good documents. All researchers should know of them and refer to them when able. But really, the main tip is seek advice. Go and chat to someone. Like, come and talk to researchers, you know, R&I, Research Governance Office. There's plenty of really experienced researchers on the units, you know, ICU, cancer, lots of different areas. Allied Health have quite a few. You'd know Steve Barrett and Owen Howlett, and yeah, some great supports and guides for our research. And find suitable people willing to review your study concepts and drafts of your protocol and your research documents before you submit them to the HREC. Because, you know, you're so busy, you reckon your question's really clear, you've done the lit review, you've worked out your methods, you know how you're going to analyse, you know how you're going to recruit, you put it all in. But sometimes you're just so close to the topic and the writing of it that you don't see, you know, you're familiar with it, but it doesn't make sense to someone who's not familiar with it pretty much. So always get someone to review and read and comment wherever possible. And as I said, the peer review process will soon be mandatory. So in a nutshell, research in a nutshell, and I stole this shamelessly. There's the reference there. You know, it is all about identifying the problem. So, and then creating a question, and I can't emphasise enough the importance of that question. Review the literature, set your research questions, objectives and hypothesis, choose the study design, deciding on the sample design, collect the data, process, analyse, write in the report, simples. If you need support, come and see us for support. More than happy. And session feedback, there's a QR code. Oh, I'm getting good at this. SurveyMonkey takes you to a brief survey and you can have your say on the session and any other sessions you'd like to see in future. That's me talking non-stop for 3/4 of an hour. My apologies. So, what haven't I covered that you would like to know? Was there something specific you were hoping for that we didn't cover?
I guess I would like to know what sort of things have been presented as a research topic that maybe have gone to QI. Like what's some examples of that?
Yeah, and look, Kate's got a recent one actually.
Yeah, I can give a good example. So down in anaesthetics, we've now just brought in using remifentanil for birthing mothers as an option for pain relief. Yeah. And we got approached from the anaesthetic department saying, I really want to do some research on this. I really want to see how this kind of plays out. And we went, well, let's actually, you know, again, take those steps back and let's ask all the questions. And it was like, well, what it is that you want to, what's your endpoint? Like, what are you trying to find? And then really drilling down, and through meetings with, you know, someone from research, someone from QI, we were kind of firing back questions back and forth and worked out, well, because it's so new, how can we say that it's a great alternative or not if we don't know if the process is going to work? So we then realised, well, actually we need to do a QI project to make sure that the program is working well enough to then be able to say what difference is it making. Because if, and you know, we have found little problems on the way that, you know, for instance, that this option is only for full-term babies, and we noticed that that it got given to a preterm baby, and then so like, okay, so we need to educate more about who it's designed for. Yeah. And then there were questions around, well, what dosage to give? Is it based on the birthing person's weight? And it was like, well, no, it isn't. So
was it based on the age of the gestation? Is that what?
Yeah. So just at the moment it's for full-term babies, but the dose that's given isn't dependent on weight. But so we're just finding these little things that so now we can improve the education around it, so that so the aim is next year we'll turn it into research, but we know that our process is solid, and we know that when we ask the questions that we want to ask, the results aren't going to be biased or influenced from, inadequate data. So basically, it comes back to that good data in equals good data out. So that we didn't want to jump into a research project when we didn't know what our data in was like. And so, yeah, like that's an example.
So a QI can just be the beginnings of.
Exactly.
Yeah, okay.
But, by the end of it, we might find that it actually solves it will definitely solve answer some of the questions, which is what is the uptake? Because we're doing enough QI cycles that by the end will it be over a year? So we'll say at the start of the year, we had 0 birthing mothers wanting to take this option. By the end, our aim is to get to 10% before, and again, that 10% will give us our numbers to be able to do proper analysis on it as well. So, and if we don't get to that 10%, well, okay, we have to figure out, is there a better way to answer that question? But let's get, we're 6 months down and I think we're at about 4%. So, now it's working out a few more ways to increase the numbers so that we can get to that 10%, so that then we can start answering the research questions. Yeah.
So what was the question was, is remifentanil better than?
Well, will birthing mothers accept it as a choice? And then because basically the long term, and I could be slightly getting this wrong, so but the long term kind of aim is if we can reduce the uptake of morphine as a pain relief option, because remifentanil is a better option, and so that's the long term aim. But at the moment is, will Bendigo Health, will patients in Bendigo Health prefer this as an option? So if we don't ever get 10%, well, then we know, okay, it's not an option, or it's definitely not an option that we'll get some meaningful research data from.
That's interesting. So who is it that comes to the research unit? Like, is it mainly medical staff, or is it a combination? Is anyone that says, hey, I've got this idea, I'm looking at exploring this further, can you help me do something with this? Is that how? Because I'm completely novice, sorry.
And look, anyone who's got an idea and wants some help, our doors are always open. So we do a fair bit at the moment with the medical students and the SIPs in particular, the scholarly intensive projects. Cameron's got us pretty heavily involved there, but with quality. So we work really quite closely now with quality and with the Research Governance Office, because Research and Innovation Department is all about activity and supporting the whole of the organisation with research and innovation activity. The Research Office is about ethics and governance. So they look after the ethics applications, the Ethics Committee, Human Research Ethics Committee, and the actual site-specific authorisations. So there's a difference between ethics. Is it ethical? Yes, that's down through one process, and then governance is all around at Bendigo Health. Is it feasible? Do you have the resources? Can you do it here? What's involved? So yeah.
Is there a lot that don't make either quality, or do you just go, oh no, that's not?
Look, there's some that
for us.
there's some that are so big that usually when we first were getting approached, it would be, I need money to do my research. And we're like, well, we don't have any, so
Find something.
But
Well, that's just at the time in the budget. Like, who decides that? Who pays for it?